Hey guys, so we are here to finish out the third part of Chapter 13, Advanced Topics and Treatments, coming from the Milady Standard Aesthetics textbook. And so if you have been keeping up or if you have watched parts number 1 and 2, you'll know that we have gone through chemical peels to microdermabrasion, ultrasound, nanoinfusion, laser, light therapy, and etc. So I'm going to fast forward my slideshow at this point, and I'm going to get us to the spa treatments, okay, which should be about here. All right, so part 3 of this video breaks down one of our more lengthier chapters and last chapter of the Milady Standard Aesthetics textbook. So this part 3 video is going to cover body treatments all the way through medical aesthetics, okay? This should be a pretty short video, so let's hop right into it. So describing spa body treatments. So spa treatments provide a wonderful relaxing experience. Body treatments have a therapeutic effect and treat the skin of the whole body. They include wraps, scrubs, and masks. Be mindful of contraindications and allergies of ingredients. So, things like seaweed and nuts, people tend to have allergies to. So, you want to make sure that you're always thoroughly consulting for your spa body treatments before working on your clients. So, when to use spa body treatments? They may be things such as body wraps or body scrubs. So, when to use body scrubs? Body wraps, and then we will do body scrubs. So, body wraps. Body wraps are treatments where product is applied to the body and then covered or wrapped. So, that is the definition of a body wrap. Okay. Treatments where product is applied to the body and then covered or wrapped is considered to be a body wrap. Body wraps are used for various reasons and can remineralize, hydrate, stimulate, detoxify, and also promote relaxation. The product used will determine the effect and the result. Aloe, gels, lotions, oils, seaweed, herbs, clay, or mud products can all be used for body wraps. Linens or plastic can be used to wrap the clients and to promote product penetration. Blankets or sheets are the cocoons of the wraps. Inch loss wraps, another type of wrap, are designed to flush toxins out of the body and promote inch loss. Inch loss wraps have a diuretic effect and are controversial in their effectiveness. If done properly, detoxifying the body may aid in weight reduction. Then we have body scrubs. Body scrubs use friction to exfoliate and hydrate, increase circulation, and nourish skin using a combination of ingredients such as ground nuts, apricot kernels, cornmeal, jojoba beads, honey, salt, or sugar combined with oil or lotion. Exfoliation treatments are also called polishes and glows. Exfoliation prepares the body to receive additional products or treatments. Dry brushing is also beneficial and is used to exfoliate and stimulate the skin. Body masks, they tend to remineralize and detoxify the body using primarily clay, mud, or seaweed mixtures. Certain body masks are used to treat cellulite. Clients are usually wrapped up after the mask application, and thus masks are similar to wraps. The ingredients and procedures used in the treatment determine whether the process is called a mask or a wrap. We also have something called hydrotherapy that you may see in higher end spas. It is another spa treatment that uses water in its 3 forms, so ice, steam, and liquid. Hydrotherapy tubs, scotch hoses, Vichy showers, Watsu massages, hot tubs, steam rooms, saunas, cold plunge pools, foot soaks, and whirlpool baths are all different forms of hydrotherapy found in spas. All spa treatments, especially intensive hydrotherapy treatments, can be powerful, so proper training is important before offering these services. There's also a such thing as balneal therapy. It is a treatment of physical ailments using therapeutic water baths. Mineral mud or fango, dead sea salt, seaweed, enzymes, or peat are used in the baths. Balneum is Latin for bath. Then we have stone massages as a part of different spa treatments. Stone massages is a technique using hot stones and cold stones in massage or other treatments. Facial stone massage can be incorporated into your regular facials. I'm not sure if you've heard of foot reflexology, but it is a thing. So, foot reflexology is another part of spa body treatments that some estheticians offer in their service or on their service menu or in their treatment room. Foot reflexology is a technique of applying pressure to the feet based on a system of zones and areas on the feet that directly corresponds to the anatomy of the body. Reflexology is performed on the feet, hands, and ears, as these are the areas that correspond to the body zones. It causes relaxation, increased circulation, and balance of the entire body. Estheticians are not usually trained in reflexology, so be aware of your scope and practice and licensing regulations. Reflexology is generally performed by licensed massage therapists. Massage can be dangerous if performed incorrectly. Then we have something beautiful called Ayurvedic body treatments. So this concept is based on three doshas or mind and body types. Treatments include Shirodhara, massage and facials using an ancient Indian concept and ingredients suited for the three body and mind types, and they include Pitta, Kapha, and Vata. Ayurveda originated over 5,000 years ago in India. It is a philosophy of medicine and balancing life and the body through various methods ranging from massage and eating habits. Ayur means life or vital power. Veda means knowledge. Ayurveda translates from Sanskrit as science of health and wellness. So Shirodhara is an Ayurvedic treatment that consists of running warm oil on the third eye area of the forehead for 30 minutes. This relaxing meditative process releases stress and calms the mind. There's also a body treatment such as endermology. Endermology is the treatment of cellulites on the high end. If you want to provide more luxurious treatments, instead of calling it cellulite treatments, you can call it endermology treatments. And it helps to stimulate the reduction of adipose tissue by vacuum massage that combines a vigorous massage with suction. Machines and other endermology methods are used in spas and medical facilities. We also have Reiki. Reiki is a Japanese technique for stress reduction and relaxation that also promotes healing. It is administered by laying on hands, and is based on the idea that an unseen life force energy flows through us and is what causes us to be alive. Other kinetic practices, including energy balancing and chakras. According to ancient Hindu philosophy, our bodies have seven major vortexes through which we process our life force energy, sometimes known as ki or chi, or excuse me, chi. A block in any of these power centers can create unbalance, disease, or an overwhelming sense of tiredness or feeling stuck. The focus of the chakra balancing is to identify any blocks in the chakras and open them up and reconnect your body, your energy body. Now we're going to delve a little bit more into common treatments used in cellulite or common treatments used to address cellulite. So, cellulite appears as dimpled or bumpy skin caused primarily by female hormones and genetics. Cellulite consists of fat cells. Dermal fat cells do swell, but that is not the only cause of cellulite. Cellulite is visible when dermal fat cells are closer to the surface of the skin. This occurs from the damage to the dermis. If water is lost and tissue is weakened, then dermal fat begins to push into the dermis. Additionally, if the epidermis is weakened or dehydrated, cellulite is more visible. Keeping collagen and elastin healthy helps reduce cellulite. To repair cellulite, cells and connective tissue need to be strengthened and hydrated through nutrients and water intake. Drinking water is not enough, however. Our cells have to be able to hold on to the water. So, wasted water in the body builds up and leads to water retention and puffiness. Blood flow and circulation of nutrients through blood vessels up to the skin also affects cellulite. Repairing cell damage, connective tissue damage, and stratum corneum damage is important in treating cellulite. The following recommended nutrients and ingredients may be beneficial for reduction of cellulite. So, for my girlies who are into body contouring and reducing cellulite, here's a list of things. So, lecithin and lipids for cell walls. Glycosaminoglycans or GAGs are great for moisturizing and firming the skin. Glucosamine to build GAGs and connective tissue. B vitamins, amino acids, essential fatty acids, antioxidants, anti-inflammatories, aloe vera, AHAs, and alpha lipoic acid are all great ingredients to help minimize and reduce the appearance of cellulite. When it comes to reducing and treating cellulite, um, the repair or the after effects, they can be temporary. Okay, you do have to have continuous sessions, and spa treatments are the way to go when it comes to reducing the appearance of cellulite. Next up, a popular term and a popular concept in aesthetics is called manual lymphatic drainage. This is popular amongst aesthetics as well as massage therapists. So, manual lymphatic drainage stimulates lymphatic fluid to flow through lymphatic vessels. MLD, or manual lymphatic drainage, is used to cleanse and detoxify the skin and the body. You can also add manual lymphatic drainage to your facials. So, this technique again helps to cleanse and detoxify the body. Congestion, water, and waste in the lymphatic vessels create edema in the tissue. Edema is nothing but swelling. Moving this fluid out of the body with light massage movements will decrease the swelling or reduce the edema from excess fluid. MLD is a great addition to a facial or other treatments. It is also used both before or after surgery because it expedites healing and enhances cell metabolism. MLD is very beneficial when performed with machines, and advanced trainings in MLD may be available to you if that is something that you're passionate about. Lastly, we're going to get into the field of medical aesthetics. So, medical aesthetics is a billion-dollar industry. The industry is constantly developing new products and services for our youth-oriented society. Plastic surgery, laser treatments, and injectables focus on maintaining a youthful appearance. Medical aesthetics integrate surgical and non-surgical procedures with aesthetic treatments. Estheticians also perform services such as peels, microdermabrasion, and light therapy. Some also assist with medical procedures and monitor patient recovery. So, in addition to those things about medical aesthetics, estheticians can indeed have a great role in a med spa setting or working with a physician. Home care products are going to be recommended by the esthetician, which helps the patient heal faster and maintain their skin's health. Because medical aesthetics is evolving, the esthetician's roles can be shaped to fit the facility's needs. Each setting varies, so it is important to define the responsibilities included in the esthetician's job description. For those of you who are looking to get into medical aesthetics, I highly recommend that you continue to educate yourself, get as many certifications under your belt, and get as much experience and knowledge under your belt as possible, and walk in confident and know your stuff. Okay. Some of the most popular services that are performed in medical aesthetics include chemical peels, microdermabrasion, Botox, fillers, laser hair removal, light therapy slash photo rejuvenation. And estheticians are not qualified to perform certain procedures, but it is important to be familiar with all of them because many clients will be asking questions to you and utilizing these procedures. So even if you're not going to be performing these services, it would behoove you to know about these services. Pre and post operative care are two big things. Estheticians perform both pre and post operative treatments and provide patient education before cosmetic surgery. These are important for faster patient recovery time. Estheticians also provide facials, uh, uh, light peels, extractions, and microdermabrasion prior to surgery. Camouflage makeup, retail sales, and patient home care counseling are other responsibilities in medical aesthetics. Preoperative care focuses on preparing the skin for the procedure. Getting the skin in its optimum state and as healthy as possible makes the surgery less traumatic on the tissue and shortens the recovery time. In terms of microdermabrasion and chemical peels, we have talked about those in part one of our chapter 13 breakdown on YouTube. So if you need a breakdown of those various chemical peels, make sure that you double back and go watch that video. But in terms of microdermabrasion and chemical peels in medical aesthetics, glycolic treatments can be performed to recondition the skin before laser resurfacing or surgery. So, sometimes to prep the skin for surgery or for laser resurfacing, you may provide, or an esthetician working in a medical setting may provide, a glycolic peel. These lunchtime peels can enhance the strength and barrier function of the epidermis, and microdermabrasion benefits to the epidermis are similar to those that are provided through AHA treatments, although the effects are more superficial. Documentation is another big thing of another big part of medical aesthetics. I feel like documentation is important regardless of if you are working solo, working in a salon or spa, or under a medical doctor supervision. You always want to document everything. You always want to have a plan of action. You always want to document what you observe and your assessments, as well as getting your patients clearance and release release statements from your clients. Other clinical procedures that are popular in medical aesthetics may include Botox injectables and fillers. And then there's a term called non-ablative. I want you guys to understand that non-ablative means that that procedure is not going to remove tissue. So, for example, non-ablative wrinkling treatments used by IPLs, they don't ablate or they don't remove any tissue um, from the skin. The light itself is doing the work. So non-ablative means that it is not going to, it's basically not abrasive, it's not invasive, it is non-ablative, okay? In terms of injectable fillers and Botox, depending on your state, some estheticians may perform these, some of them may not. Um, be reminded that FDA approved fillers are always going to be non toxic, they should be durable and biocompatible and easy to use. So make sure again that you're always keeping your clients' health and safety first, okay? Um, as far as dermal fillers, anytime someone is getting dermal fillers, usually we're going to be getting fillers to fill in lines, wrinkles, or other facial imperfections, maybe hollow areas. People may want to get filler to define their jawline or their cheekbones, okay? Lip fillers are a very popular thing as well. So there are a lot of different brands uh, as far as fillers go. And then Botox is a little bit different. So Botox is a neurotoxin that basically it, I don't want to say it paralyzes your muscles, but it blocks certain nerves, so it makes certain muscles not work. So, for example, if a person has wrinkles in their forehead because they frown a lot, or when they frown, they get those wrinkles. What Botox does is it relaxes that muscle for a while, so then when you do need to frown, your forehead does not wrinkle. So that's my breakdown on Botox and fillers. Again, make sure that you are always working in the scope of your license and understand what you can and cannot do with your aesthetics license. Other cosmetic procedures, cosmetic surgical procedures, if you see that your client has put the fact that they've had a right-ectomy on their consent form, that just means that they've had a facelift, okay? And that procedure, um, it involves removing excess fat from the jawline. It tightens loose atrophic muscles and removes sagging skin. Okay. A forehead lift is also something that your clients may have. They may also call it a brow lift. These can be performed separately from a facelift or in combination with an eye lift. Okay. A blepharoplasty is another common cosmetic procedure that clients may undergo. A blepharoplasty is an eye lift, so it removes fat and skin from the upper and lower lids, making them less baggy and crinkle looking. Okay, so when sagging eyelids tend to impede your patient's abilities or a patient's ability, it is a medical condition that can be covered by insurance. And then we have a transjunctival blepharoplasty, which is performed inside the lower eyelid to remove the bulging fat pads, which are often sometimes congenital. Rhinoplasty, if you ever see that your client has had a rhinoplasty, that just means that they've had nose surgery, okay, either to make their nose smaller or change the appearance of their nose in some way. Sometimes rhinoplasty is necessary for health reasons and to improve the patient's ability to breathe. Laser resurfacing is another procedure. A lot of times, if a person has acne scarring or wrinkles, and they may elect to have laser skin resurfacing. So, collagen remodeling stimulates the growth of new collagen in the dermis, and this type of laser treatment removes the epidermal layer and requires a recovery period. Okay, so that one definitely is ablative, definitely more invasive. Dermabrasion is a strong exfoliation method, usually performed in a medical setting. It's considered to be a medical procedure. It's a very deep exfoliation with a medical grade microdermabrasion machine. Okay. TCA, which is trichloroacetic acid pills, those are a lot of times done in a medical setting because those are really strong pills. Remember, um, TCA is only recommended for your Fitzpatrick's 1s, 2s, and 3s. It's not recommended for anyone that of a higher Fitzpatrick. We are not compatible with those pills, but TCA pills are great for addressing sun damage and wrinkles. And then phenol pills, again, we talked about that in part one. Your phenol pills are going to be the strongest pills and can be toxic. They're rarely used these days, but again, we're just highlighting it because they are a thing, and we want to make sure that you guys are educated on everything as much as we can educate you on when it comes to aesthetics. Sclerotherapy is well, now we're going to get into a few body procedures. So we have sclerotherapy, mammoplasty, liposuction, and abdominoplasty. So again, if your clients put on their intake forms that they have had any of these, that means they've had an elective body procedure. So sclerotherapy is used to minimize varicose veins. And what happens with sclerotherapy is they inject a chemical agent into those veiny areas to help them to make them collapse and be less noticeable. Okay. Varicose veins tend to be caused by heredity, race, gender, posture, hormones, and pregnancy. So a bunch of different reasons for why someone may have varicose veins. Mammoplasty is going to be a breast surgery that will either be used to enlarge the breast or reconstruct them in some way. So this procedure is also referred to as a breast augmentation or implants. Breast reductions reduces or repositions the breast. This is sometimes performed for health reasons to primarily alleviate back pain. Liposuction is a surgical procedure that removes pockets of fat, and then abdominoplasty removes excess fat deposits and loose skins from the abdomen to tuck and tighten the area. So a lot of times you will find liposuction and abdominoplasty the option for mommy makeovers or for people who are looking to just have a better quality of life. The clinical esthetician. So we are nearing the end of part 3. So working as a clinical esthetician in medical aesthetics can be very enriching. This specialty requires compassion and patience because you'll be working with people who are in pain or who are experiencing physical trauma. Many patients feel more comfortable with the esthetician than they do with a physician who may not have time for more personal and empathetic discussions. Remember to stay focused on the treatment goals and maintain a professional role at all times. The role of an esthetician can be invaluable in a medical setting in providing pre and post operative care and other patient services and education. A career in aesthetics is always exciting and fascinating. Advanced areas of study range from medical aesthetics to exotic body treatments. Light therapy and AHAs for skincare are two of the most effective tools available today to estheticians. Opportunities for advanced trainings are limitless. Okay, so make sure that you keep up with your education, keep up with your technology, and keep up with the trends. We hope that this has been a great help for you, and that is all that we have for part 3. We'll see you soon. Bye.